Welcome and thanks for joining me on Talk the Walk. I'm Sarah Wong. Hong Kong's public health system is reeling from a chronic manpower shortage that has left some residents waiting for years for consultation services at public hospitals. To help address the perilous situation, the Legislative Council has amended the Medical Registration Ordinance to allow non-locally trained doctors to practice in Hong Kong. But a special registration scheme was opposed by representatives of public doctors, with the only non-establishment lawmaker, Pia Chen from the medical sector, voting no. Dr. Raymond Cheung joins us now to weigh in on the amendment bill. He is the honorary treasurer at the Medical Licentiate Society of Hong Kong. Doctor, welcome to Talk the Walk. Thanks for joining us.
Thank you, Sarah.
Now, before we delve into the details of the bill, I want to know, can you tell us what is the root cause of the severe manpower shortage of public doctors in Hong Kong, and how much of that can be alleviated by the introduction of the special registration scheme?
Sure. Thank you, Sarah. I think the major problem about the shortage of the manpower in the public system is the unequal distribution of the general doctors in Hong Kong. We've noticed that Hong Kong has about 30,000 doctors, but we noticed there's only about 20% of doctors working in the public service, while they are serving about 70% of the local citizens. But the rest of the 70% of the private doctors are serving only at 20 to 30% of the Hong Kong citizens. So that's why we're always seeing there's a very long lineup for the special outpatient clinic in the PA system. So we know that Hong Kong is only having about 2,000 of people with one doctor, but such ratios are actually seen in other countries, like even the mainland China as well. So with establishing the new ordinance, we will only see that only maybe a short percentage or short numbers of doctors will joining us, the workforce in the public hospital in a short time. And we can see that the new ordinance will only allowing the people to work as a private doctor very soon, because they are only required to serve in the public system for 5 years, and then they can get a full registration in Hong Kong. They can soon to choose either to stay in the public system or in the private system after they working in the public system for 5 years. So how good it will be held is very questionable.
Okay, so it seems that you don't agree that the new measure, the special registration scheme, will be very effective in solving the problem of manpower shortage. But does the measure strike the right balance between maintaining the quality of Hong Kong's medical service and potential side effects on local medical talent?
Well, I would say there's a certain concern. With the new scheme, we are inviting doctors who graduate from the listed 100 universities to come back to join as a doctor in the public system. As far as what I know, there's no certain exam or any screening or even interview for them before they return to work in Hong Kong. They are only assessed by the time when they are working as a doctor in Hong Kong at the moment. So we may probably make a little bit risk that certain people who may not be as great as what we thought could actually return to Hong Kong to serve us. And also back in the old days for the exam itself, the people were not allowing to pass the exam for the 5 times, or they would eternally opted from the exam. So which means that they are not allowed to apply for the exam anymore. But the new amendment ordinance didn't say anything about, okay, for those who fail to pass the exam for more than 5 times, while if they are within the listed 100 universities, are they still allowed to return to serve in Hong Kong, or they will be screened out for the applications? It's not really explained as well.
I want to share something with you that is written by Professor Gilberto KK Leung from the University of Hong Kong. He pointed out in an article that graduates from the United States, Britain, Canada, plus New Zealand and Ireland may obtain provisional registration examination-free through the competent authority pathway of the Australian Medical Board. And he also said the Singapore Medical Council also offers a similar pathway, examination-free as well, to graduate from 103 foreign schools. So isn't it reasonable for Hong Kong to follow suit, or at least implement a similar practice that's on par with countries like the United States and the United Kingdom?
Well, I wouldn't say we shouldn't follow their examples, but I think right now having the exam is the best way to protect our local service standard. I understand there are other like well-civilized or quite good countries, they have a similar scheme allowing listed doctors to work in their own countries. Right? At the same time, Hong Kong is the only solely place that all the rest of the world doesn't really recognize our qualification. What I would say is like, for our graduates, we can't go to other countries to work straight away. I think certain mutual agreement should be made before we're allowing the other foreign countries' doctors to work with us. At the same time, having the exam itself is the most standardized method to screen out good or not quite good doctors to work back. So I wouldn't say having this scheme is completely destroying our own local service standard, but at least we should stay strong with our own exam system while supplementing with the new ordinance. But we shouldn't make this new 100 doctor list as the mainstream to improve our own local doctor service. Having the exam or improving the local HA doctors benefit, or even increasing the number of locally trained doctors may be the better way to solve the lack of manpower in our public system.
Like, apart from the criteria of the exemption of the licensing exam, the applicants, they must have graduated from recognized foreign medical schools who already registered as doctors or holders of specialist qualifications outside Hong Kong, and must be willing to work in the city's public healthcare system for 5 years after obtaining their specialist qualifications, and their service needs to be considered satisfactory and competent. Now, only then can they obtain full registration in Hong Kong without the need to pass the exam, and also have the option to work in the private sector. Now, lawmaker and Dr. Pia Chan, he said the move damaged a fair examination system and professional autonomy. Do you agree with Dr. Chan, and what else is needed to uphold the standards of Hong Kong's medical service?
Although we do have overseas invigilators for our own local exams, but we still maintain our own high standards of our whole local doctors. So like this, I think apart from what been explained, that we should make a really precise list of colleges, because there are too many colleges in the world. They got releasing, or they appointing, giving specialist qualifications to different doctors. I think we should really make a really tight or good gate in which college we recognize in Hong Kong, to allow who passed all this only recognized college to return to serve in Hong Kong. Otherwise, if we have a very loose list of all these colleges, we will somehow really dampen our local doctor service. And as the Hong Kong exam are always quite not easy, difficult, we're maintaining pretty high standards for our local trainees, and examination is pretty high, requesting doctors to perform pretty well before they can have the specialist qualifications. We should really maintain a very tight list of recognized overseas specialist colleges before we allow other doctors to return or to come to join our workforce.
Health Chief Sophia Chen, she said after the passage of the amendment bill that the special registration scheme was not meant for a replacement of the licensing exam, but instead was offered as an alternative pathway to increase the number and increase the manpower of public hospitals. Do you think it's a good idea or it's an executable idea to do it both ways?
With this new ordinance, is it definitely able for them to improve the shortage? I really doubt how many doctors will return with this scheme. Like, for example, for a well-trained specialist who had already established their own career path in overseas, how eager they were keen to return to Hong Kong once they are specialists. Because we know that we really lack of specialists in the public system. We got doctors going to overseas or going to private practice in recent years. We lack of quite a lot of specialists. With this scheme, are we able to attract more overseas specialists to return for our system? I really in doubt. And we also need to have a better change in our HA public system so that the doctors are not too overwhelmed or they can enjoy a better rest time, or more or less different changes in our working system so that they can maintain more doctors to stay in the public system to serve our local communities. So, and then the third thing is exam itself. You have only quite a limited number of seats that can go through each of the practical exam. Let me explain. Because for all the students joining the licensing exam, they have to go through the first part and second part, which are the written exam. And the third part will be the clinical exam, including 4 areas: medical, surgery, obstetric, and pediatrics. They have to get past all 4 areas before they can get the LMCHK and to work in Hong Kong with the internship. But right now, we're only seeing there's only about 60 to 70 candidates allowed to join each of the clinical exams. And definitely not all of them can pass the clinical exam. So each year or each half year, only a little numbers of doctors could return or at least to join the clinical exam. And having said that, in the last 2 years, it had been stopped or postponed due to the COVID-19, and it just resumed in this November for the practical exam. So we can see there's a big lot of doctors who have been stuck, not able to join the practical exam, and they're still pending to wait for the next round in 2022. So there could be also another change in the practical exam for the licensing, the LCHK, so that they can get more people to join in the exam, so that the numbers of doctors possibly to pass the exam will be increased. That would really help the local system.
I see. Well, let's pick up the discussion after the break. Talk the Walk will be back in a moment. Don't go away.